Hi, this is Brenda Gaskins. I'm an RN Transition Coordinator for Utica Park Clinic. I'm here today to talk to you about transitional care management. So what is transitional care management? It is a care management model that focuses on transitioning a patient with complex healthcare needs from one level of care to another. Typically, it's from an acute care setting to home, but it may also include transitioning a patient to a skilled nursing facility or long-term acute care setting. The goal of transitional care is transitioning a patient back to home. Our goal then is to decrease readmission. So transition of care became a priority as a result of the Affordable Care Act of 2012. It is a Medicare incentive program designed to decrease readmission rates, and it is a billable service under Medicare. Why is transitional care important? Well, preventing readmissions and preventing the bounce back. It improves patient satisfaction scores, engages the patient in their care, and it does this by identifying factors that may result in readmissions, such as barriers to care, lack of transportation, limited access to providers, and psychosocial and economic limitations, and low health literacy. So a transition coordinator is an individual that interacts with the healthcare team on a variety of levels, and they ensure that the patient has access to these things. So they ensure that they have access to follow-up care, able to get their medications, and identifies needs for community services. So there are various different models for transitional care. There's a couple that are widely renowned, the Naylor and Coleman. Most models today use a combination of this, and they're community-based. This next slide shows 6 key components of an effective transition process. And on this slide, it does note that all patients need discharge planning and go through a process. However, we identify patients that are high risk, and so there's a more in-depth assessment, and then there's handoff process to the primary care setting. So as a transition coordinator, our process starts with an assessment. Our initial assessment would start with reviewing electronic medical records. We look at LACE scores, LACE plus boost scores. We attend bed huddles. That is an interdisciplinary meeting that occurs every day on our units in the hospital. In those huddles, we have our nursing staff, we have case management, social workers, dietary, physical therapists, and the hospitalists. And everybody comes together to identify what the patient's needs are and to assist in developing a discharge plan. We then go in for a more in-depth assessment based on our recognition of those that are high risk. That includes going to the bedside and visiting with the patient. There we're looking at their health literacy, any barriers to a safe transition home, such as lack of caregiver, lack of resources to obtain medications, transportation issues. We establish goals of care, and then we develop a patient-centered plan of care from there. This is then communicated back with case management. We participate in setting up resources, and we communicate with and coordinate care with post-acute providers such as home health, SNFs, LTACs, rehabs, hospice. We identify what the resources are for getting medications, and we have a meds-to-beds program that we participate with in the event that the patient is not able to obtain medications when they discharge home, then that is something that we have delivered to the bedside prior to discharge. When the patient does we'd also review discharge instructions with the patient, and we assist in scheduling their follow-up appointments with primary care physicians, coordinate with specialists, and assist with scheduling other testing, and just overall arrange for follow-up care. After the patient is discharged home, then we we do a telephone follow-up call 24 to 48 hours after they go home. Sometimes we plan a home visit, depending on what our bedside assessment revealed. And if we do a home visit, normally we're doing some medication reconciliation in the home, but we also do that over the telephone when we talk to them as well. And we try to fill in any gaps that may have occurred, make sure durable medical equipment is received timely, any home health services, making sure that everything is communicated there and they have all the resources and information that they need. We also have a slide that shows our workflow a little more detailed, and it does show where the inpatient assessment, and it identifies all the team members that are involved in the process of putting together a safe discharge plan. After the patient is home and we've done our 24-hour call, and usually even before they discharge home, we communicate with our Utica Park Clinic care coordinators just to update them as what the progress is and what kind of needs may be needed after they discharge home. After that, when the patient does come back into the clinic, a transition to care PCP follow-up is scheduled within a week, and at that time the care coordinator may meet with the patient and address any additional needs and establish a rapport there so there's good communication within the clinic. From there then, if the patient is not a Utica, let me back up a second here. From there then, if the patient is not with Utica Park Clinic or another clinic outside the home, we do our telephone follow-up, and if all goes well, they would discharge from the program at 30 days without readmission, and that would be goals met. So our goal is 30 days without readmission to the hospital. And so in summary, our transition of care addresses the many reasons that patients may readmit to the hospital, such as no home support, medication-related issues, transportation-related issues, and communication issues. Transition of care coordination is a valuable tool in decreasing readmissions. It improves outcomes by engaging the patient in their care, enhancing communication with caregivers and providers, and promoting access to community resources. So I hope you enjoyed our presentation. I'm looking forward to meeting everybody at the symposium, and have a good day.